Hi, thank you, MC. Good afternoon, everyone. Now, today, let us learn about the mystery between our respiratory tract and gastrointestinal tract. So for last episode, we talked about our gastrointestinal tract. So today, let us learn about what the respiratory system is before digging deeper into it. Now, let us look at this diagram. Many of our understanding about the respiratory system are lungs. So lungs are our respiratory system, but actually lungs is the last area. So actually our respiratory system starts from our nasal cavity. So we inhale air from our nasal cavity and it goes through our throat. And as we go further down, this lane is known as the trachea. And further down the trachea, it was split into two bronchi. And these two bronchi would be in our lungs. So as for our lungs, a very, very important part is the bronchioles. And they look kind of like branches. And at the end of the branches, there are actually many small, tiny bubbles. Okay, let us look at the next one. These are called pulmonary alveolus, and it is a very, very important structure. Why? Because when we breathe, right, we need to bring in oxygen. So where should we bring them in from? When we inhale it into our lungs, they will stay in our pulmonary alveolus. Pulmonary alveolus are very thin, which is that its walls, the cells are very thin, and it only has one layer of cells. So these pulmonary alveolus are thin so that the oxygen can easily penetrate through our pulmonary alveolus and enter the blood vessels around it. So these pulmonary alveolus contains many fine blood vessels around it, and it requires the interaction between the alveoli and the blood vessels. So the carbon dioxide in our blood would also enter our alveoli and be released when we exhale. And the oxygen we inhale goes through our alveoli, passes through and enters our blood. And when it reaches our blood, the red blood cells would integrate with the oxygen and then deliver all these oxygen to our whole body, which is through our cardiovascular system. So through this whole process with our lungs, blood vessels, and the blood's cooperation, we're able to get fresh oxygen and eliminate the carbon dioxide that we don't want. And so this is basically the whole function of our respiratory system. As we are talking about the respiratory system, of course, everyone is concerned if there are any chronic respiratory diseases and what are the more common ones. So for our respiratory system, it is divided into upper respiratory tract and lower respiratory tract. So from our nasal cavity to our throat, that is considered our upper respiratory tract. So for upper respiratory tract chronic diseases, some more common ones are like cold, like a normal cold. If you have any of these symptoms like coughing, sore throat, runny nose, all these are because your respiratory tract are infected. And next is asthma and chronic obstructive pulmonary diseases, COPD. For these, we would dig deeper into it later on, but all these are considered upper respiratory tract. And as for lower respiratory tract, it is from our bronchus to the rest of our lungs. And the whole area is our lower respiratory tract. And for that, there's pneumonia. Pneumonia is because your lungs are infected, and there's lung cancer and pleural effusion, which is what others would say as stagnant water in lungs. And for this problem, it is also at our lungs and chest cavity area. And these are a few more common problems, like maybe those around you might have these problems. And earlier I've mentioned that we would discuss about the relationship between respiratory system and gastrointestinal tract, right? So how are they related? Our lungs and our large intestines and small intestines are separated. So how are they related? Actually, our lungs and stomach, they're like a highway, and they can actually communicate with each other. And it is actually a two-way communication center, so it's not just one-sided. Both of them would affect one another. And everyone knows that there are bacteria in our large intestines, right? There are good ones and bad ones. Actually, in our lungs, there are also many different bacteria. And in our lungs, of course, the amount it has is not as much as of our intestines, but it also has a lot. Because of these two organs, both of them can communicate with each other, and both affects one another too. At the same time, it would also help with our immune condition, the response, and the functions of our body's immune system. So some might start wondering, because previously many had heard that if we consume probiotics, after consuming it, the probiotics would go to your lungs. And the food you eat goes into your stomach and later on finishes off at your large intestines. But actually, when probiotics are consumed, actually needs to reproduce in your large intestines. And the good bacteria needs to multiply over at your large intestines, multiply more and more. So this is what we want. And people want to ask, why do they say that supplementing on probiotic is good for our lung areas? It went to our lungs? Actually, that's not the case. Actually, that's not the case. So what tract did it use to communicate? Where is their highway? Actually, it is through our lymphatic system and our circulatory system. These two systems are the tracts that our lungs and large intestines uses to communicate. So actually, our stomach has a type of lymphatic system, and we call it as gastric membranous lymphatic system. And the probiotics in our large intestines, or like just any bacteria, whether good or bad, or like the metabolites formed by the bacteria, metabolites doesn't mean it's bad, because there are also good ones and bad ones. So for these bacteria's metabolites, they can actually go through our intestinal barrier and enter the lymphatic system and enter our circulatory system as well. And it would regulate the immune response. So through the blood circulation and lymphatic circulation, it goes to our lungs and would help us to regulate the immune response of our lungs as well. And that is how they communicate. It is a two-way interaction. Actually, if the probiotic in our lungs are imbalanced, let's say our lungs are infected, actually, according to research, it would affect the health of our large intestines. At the same time, if your large intestines are infected, it would also affect the health of your lungs and its immune. And your large intestines might also have some factors that will cause damage to the cells in your lungs. Through blood and through the lymph nodes, it will get to your lungs, and in return, it would cause inflammation. So take a look. What are the symptoms when your lungs are infected? And so your stomach might hurt, or you might have like diarrhea, right? Like stomach pain or diarrhea, or like maybe some might have asthma and have stomach bloating, etc. And this is because both are interrelated and affects one another. And its effect on one another isn't like the bacteria directly fly towards your lungs, or your lungs bacteria directly fly to your large intestines, but it's actually through our lymphatic system and our circulatory system as a way to communicate. So that is why we say that if your guts have a very balanced probiotics, actually it's good to our lungs function and immune. And this is because these probiotics would regulate our body's immune cells and regulate the immune system. So it would increase certain immune cells and increase immune cells response and functions. And with that, they can be delivered into other areas through our blood flow, which includes our lungs. And this is why these two are interrelated. Studies shown that many respiratory diseases, such as asthma and chronic obstructive pulmonary diseases, and also what is known as the cystic fibrosis, which is when the lungs or the whole respiratory tract, they would have like fibers. So those will actually affect your breathing. And then there's cancer as well as various lung infections. Actually, all these respiratory diseases are related to our stomach and large intestines. So that is why large intestines is correlated with probiotics. So what leads to our probiotics to be imbalanced? The biggest factor is because in today's society, many would eat antibiotics and would simply eat antibiotics. So it might be because the method they are eating is inaccurate or have been overdosing on it. And these would affect the flora in our guts because these antibiotics wouldn't especially only kill off the bad bacteria. As long as you eat them, they will kill all good and bad ones. And after killing it, and if you overdose, some bacteria might turn into superbugs where they are no longer afraid of the antibiotics and will keeping its guard against it. In return, this would affect the balance of the bacteria in our large intestines. Another thing is smoking. Smoking would greatly affect the bacteria in our large intestines. According to studies, they found that those who smoke, the probiotics in their guts would be imbalanced. Besides, it would also increase the risk of having infections. Another one is our daily dietary intake. If your diet are more towards the Western side, let's say high in oil content, especially those meat that are high in fats. Next is when you lack dietary fiber, which is when you consume less fruits and veggies. Let's say by eating a lot of fast foods. So all these would affect the balance of our gut's flora. Actually, probiotics needs a specific environment to grow. It needs certain carbs, and these carbs usually can't be digested by our small intestines. In other words, a lot of the things that they need are carbs that can't be digested, which is also known as soluble fiber. And when they reaches the large intestines, they will be broken down by the bacteria. So they're actually quite specific. But I wouldn't go further into it as it is very complicated. So there are some fiber when they reaches the large intestines, they are the things that the probiotic needs. So if your diet often lacks fruits, veggies, and antioxidants, gradually your large intestine's probiotics would be imbalanced. Because your diet is high in sodium, sugar, and oil, and that would allow the bad bacteria to grow up happily. To grow up more quickly. As for good bacteria, they need veggies and fruits to grow. Okay, this is the antibiotic, smoking, and Western diet we mentioned earlier that will lead to an imbalanced gut flora. With that, it would also increase the risk of getting the respiratory diseases, or maybe if you are already diagnosed with it and you want to treat it, its response would be slower. How do we prove that? Well, according to studies, patients with asthma, COPD, or lung cancer or lung infections, they realize that if they allow them to supplement on probiotics, as how I've said, replenishing on probiotics goes into your gut. But we realize that after replenishing on probiotics, it has better effects for the treatment for their illnesses. And it can also decrease the risk of getting back the infections, and increase the effects of the medications or treatments they're getting. So once again, this proves that actually large intestines and lungs are interrelated. So while we are taking care of our respiratory health, we also need to take care of our gut's health as well. To put it in another way, our gut affects our whole body, and our respiratory are a part of it. Today, let us have a better understanding of Yummy Warrior. How does it benefit our respiratory system? First off, we need to understand its components. So in Yummy Warrior, there are two main active components. The first one is probiotics. And this probiotic is known as BL04, Bifidobacterium lactis. The second important one is yeast beta-glucan. For these two, we will dig deeper into it. Actually, Yummy Warrior, even though it's a type of probiotic, it is in a form of a chewable tablet. So everyone can chew on it or can suck on it like a candy. It's very candy-like, but it is not like any other candy. Because normal candy actually only contains sugar and coloring. It does not contain any nutrients or like some supplements. But as for Yummy Warrior, as mentioned, it is not candy. So it has two main components. Let us look at the very first component. The first component is Bifidobacterium lactis, BL04. Did you guys know that actually when you're getting probiotics, the most important thing is to ensure it remains undamaged when it reaches your large intestines, because in our stomach is very acidic. And mainly it acts as a protective mechanism, because if you ate some bacteria, it can be all killed in your stomach and you won't get infected or have diarrhea. But then these good bacteria, you can't let them die in your stomach, right? You want it to be alive when it reaches your large intestines so that it can remain there, reproduce, and help to balance out your gut's environment. Most importantly, we need to ensure that this BL04 is very stable so that the BL04 probiotics had gone through a special manufacturing process. During this manufacturing process, they can ensure that these bacteria, when it reaches your stomach, it is acid resistant, which means that when it reaches your stomach, 98% of the flora are still alive. And after it reaches through the small intestines, it would encounter another thing, which is our gallbladder. So our gallbladder is in charge of to digest and to break down. And even through the gallbladder, it is still alive, and then it only reaches your large intestines. This is what makes the BL04 special, which is to ensure that its whole process, the most important thing is its stability. So we can ensure that it won't be disrupted during its journey to our large intestines and is able to withstand all the harsh conditions. Secondly, no refrigeration is required as it is very stable. It is not even afraid of your stomach. So when you're manufacturing this product, the main point is that it doesn't need to be refrigerated. And then when you consume it, it can safely reach your large intestines. So from the choice of our flora, the concentration and the extraction of its Bifidobacterium. So from the choice of our flora to the concentration and extraction of its active components through the patented technology on stabilization process of probiotics, it can be stored nicely. Each batch are also tested to ensure that it is the flora that we want. Actually, this flora had also been awarded in certain areas, all of which are how they are the probiotics that doctors recommend for respiratory health. And which is, if you want to supplement on probiotics for your respiratory tract, BL04 would be doctor's #1 choice. Okay, the next main component is beta-glucan. Many's understanding of beta-glucan is that it only protects the heart, because the beta-glucan that everyone hears is from oats. But actually, there are many types of beta-glucan. How do we differentiate them? We can differentiate by looking at the beta-glucan structure. So its structure is like a long chain, and along its long chain, there would be other chains sticking out. It's like how digits, they're like crisscrossing each other. So it has many types of splitting arrangement, but actually they are different types of beta-glucan. The ones we use in Yummy Warrior is long beta 1,6 and branched beta 1,3 glucan. Okay, no worries if you don't understand it, but all you need to know is that it is different from beta-glucan found in oats. Those are for you to decrease your cholesterol levels and decrease the risk of getting cardiovascular diseases. But for the beta-glucan extracted from yeast, they are for our immunity. It can activate our immune cells and allow our immune cells to respond better. So let us have a better understanding. How are the beta-glucan extracted? Actually, everyone knows that this beta-glucan comes from the yeast, but we're not making bread, so we won't be putting the whole yeast in Yummy Warrior, but actually we are extracting the beta-glucan that we want from yeast. This process requires skills. So yeast has an outer layer of protein that protects its structure, and the beta-glucan we need is inside and is protected by the layer. If we want to extract it out, we first need to break apart the outer layer, destroy it first, and then only can we extract the beta-glucan out, because the insides are the active components that we need. So if you want a quicker method and a more affordable method, you can use chemical to destroy the outer layer, and then it would release the beta-glucan that you want. But there's a bad thing about this process, and it would affect the purity of the beta-glucan and influence the benefit that the beta-glucan can bring to us. So in Yummy Warrior, the method we use is also a patented method. It doesn't use any aggressive chemicals. Instead, it uses a gentle processing method so that it can gently open out the outer layer and extract the beta-glucan. So for this method, it actually allows you to extract 85% of pure beta-glucan. That's right. And next, its other function. What are the functions of next? Its function. What are the functions of beta-glucan? Which is, after consuming it, it would bind together with your immune cells. So how do we know if the combination is high? That depends on your manufacturing process. So if you're using this patented technology, there's up to 22% of binding action, as compared to if you use aggressive chemicals to extract, the binding would be lower. But if you use a special processing method, its purity would be higher, and at the same time, its binding action would be higher too. This means that it will be more beneficial in boosting our immune and its functions. How do we obtain this processing method? This is because there was a yeast product professional with 60 years of experience. They had this unique technology to reach that. And the beta-glucan extracted in Yummy Warrior, you need to remember that what makes it different is that one, it has higher purity, and second, it has a higher binding action due to its processing method. To conclude, there are two main components in Yummy Warrior. The first one is BL04, the Bifidobacterium lactis. And this Bifidobacterium lactis has a really stabilized technology that allows it to efficiently preserve the probiotics and have it reach our large intestines, so that it can help balance out the gut flora and regulate our gut without any refrigeration required. Next, we have beta-glucan, and it comes from natural yeast. So its processing method is also very pure and natural. And it's more effective as it has higher purity and higher binding action. So it can help increase our immune functions. As for probiotics, earlier we mentioned that many studies have found that if those with certain respiratory diseases or infections replenish on probiotics, it can reduce the inflammation rate and increase the medication's effectiveness, right? And next is if those with any symptoms, such as a cold, studies also found that after replenishing on it, in just 2 weeks' time. Those who replenished have a lesser respiratory tracts as compared to those who have a lesser respiratory tract symptom as compared to those who didn't replenish. So for beta-glucan, its main function is to strengthen. How does it strengthen? It's like a military advisors for troops. After you consume it, it will bind with your cells. And during this binding process, it is actually activating your cells. And it allows them to produce antibacterial or antivirus factors more effectively. So before you fall ill, it will train your immune cells so that they are clear and will have a faster response on what to do when time comes. So with these two combined, you will get protection, reduction, and enhancement. Enhancement is to enhance your immunity. Protection is to protect you before you encounter any problems. And reduction is to reduce. Touch wood if you have fallen ill, and it can help you to reduce respiratory tract symptoms or some discomforts. Okay, that's it for my sharing. I hope that everyone has a better understanding about the relationship between our respiratory tract and the GI tract. So see you guys next time. Bye-bye.